Spring Hill College's nursing division has been ranked yet again as the top Bachelor of Science of Nursing program in the state of Alabama. This comes as rncareers.org released their 6th annual report saying, quote, Spring Hill College ranked number 1 in Alabama and is one of the best nursing schools in the nation, with an impressive average NCLEX first-time passing rate of 96.78% for the ranking period of the last 3 years. Out of over 1,700 schools examined, Spring Hill College Nursing School ranked number 77 nationally. Tess, who is from Omaha, Nebraska, is a current junior in the program. Nursing is very much a calling, and I'm sure that has been evident to you even as a student. When did you know that you wanted to be a nurse?
Well, I've always sort of been interested in the medical field, sort of for as long as I can remember. I guess I sort of got interested in it first in high school when I started shadowing people in hospitals and I realized I really had a calling towards nursing. My grandma was also a nurse, so that was sort of a sign that I was headed in the right direction.
As I am sure you're aware, you are currently in a top-ranked program. What do you think it is about Spring Hill's nursing program that sets it apart from so many others in the state and even across the nation?
Well, one thing that has really stood out to me is our amazing clinical instructors. For clinical, we go into hospitals and we work one-on-one with patients just like real nurses. And our clinical instructors are there to guide us and help us learn and teach us. I have had an amazing experience with every single one of my instructors. They are so welcoming in the hospital. They do an amazing job of making me feel confident in what I'm doing and helping me push myself to do better and be a better nurse.
You have been in the program for 2 years now. It is my understanding that you recently went through clinicals. Can you give me a walkthrough of your typical day as a nursing student?
Your typical day as a nursing student is that there is no typical day. At clinical, it depends on what course you're in, but most of the time you show up and you are given a patient and it is your job to learn everything there is about that patient. So you look up their medication, you look up their medical history, and you try and familiarize yourself as much as possible with their situation and why they're in the hospital. And then we usually review the information with our instructor, and then it is your job to take care of everything that patient needs. So that can include more simple tasks like, giving them a bath or helping them change their bed, helping them get changed, to things like IVs, catheters, and real nursing skills in the hospital.
How was it giving out doses of the COVID-19 vaccine?
It was honestly an amazing experience because we all have been affected by the pandemic. I was here last year when we were sent home in the middle of my Foundations nursing course, it's called Foundations. It's because it's the foundations of nursing. It's everything you need to know. We all missed the end of last year. We all felt unprepared coming back. So to be some of the first people to be able to give out the vaccine and take this step towards ending the pandemic was an amazing experience.
Your senior year is approaching, which means that you are just a step closer to graduation. Do you have any plans to intern in the near future?
Yes, I actually do. I have an internship lined up right now in New Orleans for the summer, and I will be working in the ER, which I'm really excited for. I'm interested in critical care in the future, and I'm definitely going to be pushing myself with this ER internship, but I'm very excited for it.
Thank you for listening to our podcast. I hope that if you haven't already, you find your calling as well, and perhaps allow Spring Hill College to help you fulfill it. For more information about the nursing division and other majors at Spring Hill College, go to shc.edu.